Yeah, just a quick review of the Physflex knee brace. So this brace, I kind of think of it more as a sleeve. Sleeves are just kind of like it says, just like a sleeve that just kind of fits over there. Braces I think of as more rigid. You know, they might have some metal stays on the side. But this I think more of a sleeve. But anyway, nonetheless, the sleeve is made specifically for people that have some type of knee pain or have some type of knee problem. And the idea here is that, you put the sleeve on and it supports the joint, helps support the surrounding soft tissues, the muscles around your knee, and it restricts your motion a little bit, gives you some support. So that way your knee has a chance to rest, recover, and won't get so overstressed as you're doing things. That's the main idea. So a few points about this particular sleeve. It does have these silicone gel waves. So these things are sometimes prone to slipping down as you're doing things, which is really annoying because that's not really supporting your knee. So what they do is they put the inside of here, they put these little silicone wavy things, wavy lines. So that actually helps hold it up so you don't have that problem. The other thing I like about this, it has a pretty breathable fabric, which is important because if you wear this, you're probably going to wear this when you're active. So when you're more active, you have more tendency, you might sweat, you're doing some, sporting activities or something, especially in the summer months when it's hot. If you wear this all the time, it's going to get kind of sweaty, and then you have to worry about washing it and that kind of stuff. So best to start out with a highly breathable fabric first. So that's another good point. Anyway, other things you can do if you're having knee problems, as one resource, Bulletproof Your Knee. This is where I'm getting this stuff from. If you have any kind of knee problem, make sure that you strengthen your quadriceps muscle. You're doing at least one exercise for that. Your quadriceps is a big muscle on the top of your leg, and it's the main stabilizer of your knee joint. It's a big, big stabilizer. So what you're finding, so there's the kneecap there, and then your quadriceps is right above there, right on top. What they're finding, if they look at people with various knee problems, as a matter of fact, just about any knee problem you can name, I can probably show you a study that shows that the quadriceps just aren't really normal, what they're supposed to be. Researchers are looking at mainly the strength. So if you take people with, say, knee swelling in the quadriceps, check this one out. Another study demonstrated that even as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, is enough to decrease the strength of your quadriceps muscle. The other thing they're also finding in some of these studies, if they do CT scans and they look at the cross-sectional area of the muscle, they find that it's smaller than normal. So the problems they're finding is it's weaker than normal compared to the other muscles around the knee. So it's really kind of a selective problem with just the quads, or it's smaller. Knee injuries in the quadriceps, if you have any kind of knee injury, fractured your tibia, like broken your lower leg bone, any surgery on your knee where they open up the joint, researchers finding when they look at people with these problems, that it's definitely, well, here's an injured leg was smaller. Here again, strength was decreased. Ligament problems, and here's a big one. Anterior cruciate ligament, also known as your ACL. This one looked at people that had ruptured their ACL and anterior cruciate ligament. They found that the quadricep muscle was decreased, the strength was decreased by 25 to 30%. Now that's a significant compromise of your knee stability. And that causes you, because you don't have stability every time you take a step, you're going to start stressing out other structures and have secondary problems. The posterior cruciate ligament, PCL, same thing, medial collateral ligament. Knee pain in the quadriceps, when you look at people that have had, chronic pain, they have weak quads. Knee arthritis in the quadriceps, that's an interesting one. So a lot of research showing that if you have knee arthritis, you have weak quads. Likewise, there's actually studies showing good randomized controlled trials. If you take a group of people with knee arthritis and you just strengthen their quadriceps muscle, their knee pain starts to go away. Also, they find that people with a stronger quadricep muscles have less progression of knee arthritis. So actually, strengthening your quads can actually slow down the rate of knee arthritis. Some studies are showing patellofemoral pain syndrome. I mean, this just goes on and on. Any kind of knee trouble, even if it's just knee pain, it's non-specific, make sure you're strengthening your quads, at least one exercise. Fine-tune control over your knee. Here they're talking about the hip muscles. Sometimes you can have knee pain, and the problem really has nothing to do with your knee. There's problems up at the hip. Classic example is iliotibial band syndrome. So, for instance, if you take a group of people with iliotibial band syndrome and you test their hip muscles, they have unusually weak hip abductors. Hip abductors, like the gluteus medius muscle, helps keep your pelvis level every time you take a step. Also brings your leg out to the side. Likewise, here again, randomized controlled trials showing that if you take a group of people with iliotibial band syndrome and you strengthen their hip abductors, the iliotibial band syndrome goes away. So, interesting. Optimize knee flexibility. So we all know that you need a flexible knee, right? It needs to be able to bend and straighten. What a lot of people don't know is that your knee actually rotates as well. About the last 15 degrees of extension, that's you straightening your knee fully. Your knee actually rotates laterally or out to the side. Here's a little test to see if you have that accessory motion, which you need for a fully functioning knee. Other things you can do, this is pretty interesting. Increased dynamic knee stability. Okay, so here they're talking about proprioception. So if I turn the lights out right now and the room is pitch dark, probably be able to tell me if probably tell me if your knee was bent or straight. And that's because you have joint receptors and receptors in the knee, nerves in your knee that constantly give your brain feedback as to where your knee is in space. So that way you know where to put your knee, where your knee is in space. Anyway, what they're finding, if you take people with various knee problems and you test their proprioception, you find it just isn't what it should be. It's not like they can't know where their knee is or anything. It's basically just because it's just not up to par. So that's another function of your knee that you would want to improve to have a fully functioning knee. Remember, knee pain a lot of times is caused by some dysfunction in your knee. So if you improve the function, then the pain goes away. So anyway, lots of things you can do there. But anyway, nothing as quick as putting on a sleeve or a brace. This is a pretty good sleeve, so yeah, check it out.